Levitt, good friend of the program. Welcome, Doctor. And I'll tell you that I have voted early here in the state of Florida, but what do you think the effect of the coronavirus is going to have in these critical elections in some fairly big states, and critical, of course, to Bernie Sanders even staying with us in this race?
Well, that's an interesting question. The presidential guidelines by the White House are very clear now that shouldn't be more than 10 people congregating in any one place. So clearly there's data and evidence that shows that the virus is being passed from person to persons who are in close proximity. We know that it has a 2 to 3 day life period on surfaces. So I think it probably will mean that some people will be staying home if they haven't voted early. And certainly African Americans are no exception in that regard.
Could this have a huge impact on the overall race coming up in November?
It could. It could potentially. If people didn't get in early voting and the public health experts aren't working with the people running the polls to ensure that it's a safe environment, it could mean a much lower turnout than one might expect. There is kind of this myth going around that we have to be aware of, that blacks may be immune. I want to say to everyone that that is entirely not true. There is no such thing as race-based resilience to COVID-19. And so I think people are scared, and I can see the election not just being affected in terms of low turnout, but it begs the question in a public emergency whether we should be postponing elections to begin with.
Dr. Levitt, let me ask you this, speaking in terms of November. If you are President Trump at this point, you've got not only the coronavirus disaster to deal with, but you've also got the economy, which you've banked on all of these 3 years. That's going down the tank, as well as the stock markets as well. How concerned are you right now heading to November?
Well, listen, I think the president and his administration erred, and they've acknowledged as such. They should have been on top of this in early January when the virus was discovered in Wuhan, China. The Secretary of Health and Human Services did declare a state of emergency, but they really took no significant action to warn the American population and the necessary precautions. We're now 3 months in. They're projecting up to 200 million people might be affected in the United States. This is a horrible catastrophe for the president, and when people's families begin to be affected, I think we'll see the result of that at the polls. What makes it worse is the president has not acknowledged that his administration has been slow to respond, but I think this is going to affect him at the polls, and it should affect him at the polls.
And looking beyond November into the future electoral process, now that we've had the coronavirus, do you see more states going the way of Washington State, where it's total mail-in, so that people don't have to go to the polls, or there's some kind of way to do it online so that people can participate without actually having to physically go into a building and do it?
Yeah, it's a double-edged sword there in some ways, because there's a lot of mixed messaging. On the one hand, they're telling people to stay home, to hunker down, not to congregate in a group more than 10. 2 days ago it was 50. 2 days before that it was 250. So people are scared and don't quite know how to react. At the same time, if we're going to introduce new technology to allow people to vote online, that'd be convenient, that'd be great. But as you know, we don't have the safest systems. We've had problems with electronic, not just polling, but voting in the past. We know that from some of what we're seeing on the internet, there is a covert campaign influence again by foreign adversaries that are trying to project the American population in a way that will move into an era that there's a nationwide frenzy. We see that with some of the, not just the mixed messaging, but also with some of the messaging that's coming out about whether it's African Americans being immune, or whether there's going to be a national quarantine. So the mixed messaging, I think, is going to be a problem irrespective of the technology that's being used.
Dr. Levitt, do you think that this type of crisis is something that could change the politics of America forever, perhaps bringing Democrats and Republicans together more often for bipartisanship on matters of health care and the economy?
Well, I think part of that answer is it depends on who's in the White House and who's in the Congress, whether the Democrats control, whether Republicans control the personalities of the leaders. You would think that during a national catastrophe, we'd be able to come together as Americans. We would be able to demonstrate that historic resilience that is America and move past this. The president's tone has changed in the last 2 days. It needed to change in order for him to lead, for people to listen. I think he's gotten the memo and the message. How long it will last, we don't know. But whether it ushers in a new era of cooperation, I don't know. Sometimes when there's a third enemy and it's not the first and second enemy, you can coalesce those forces. I tend to think these things are temporary. When there's a new normal again, as long as the new normal doesn't restructure our economy and body politic in any significant ways, I think we'll go back to the partisanship that we've seen in the past 2 years.
All right, Dr. Jeremy Levitt in Orlando, please stay safe down there. We do know that you're not going to be going to Disney World anytime soon. But thank you so much for joining us. We appreciate it. We'll talk to you tomorrow and beyond. Please stay with us, folks. Our special coverage continues right after the break.